Healthy Living with Van warmly greets all of you, my dear uncles, aunts, and cherished elder friends. I am a doctor, now over 50 years old, with more than 30 years of experience walking alongside patients. Today, I would like to talk with you about a disease that almost every one of us, as we step into old age, has heard about to some extent: cataracts. This is the leading cause of blindness in older adults. But the good news is, cataracts are completely treatable if we recognize them early and intervene at the right time. The lens, the clear crystal of the eye. Imagine that our eye is like a camera. The retina is the film, while the lens is the transparent glass that helps light pass through and form a clear picture. When we are young, this lens is as clear as crystal. But with time, it gradually becomes cloudy, like a window covered with dust. That is a cataract. A 65-year-old woman once told me, "Doctor, I see my grandchildren as if through a fog. I can see their faces, but everything is blurred." That's exactly how many patients describe cataracts in the early stage. Why do we get cataracts? The most common reason is aging. After age 50, the proteins in the lens start to change, slowly clumping together and forming cloudy patches. Other risk factors include: diabetes increases risk several times, prolonged exposure to sunlight and UV rays, long-term use of corticosteroids, eye injury, smoking and heavy alcohol use. So, cataracts are not only about aging, but also about lifestyle, underlying diseases, and daily environmental exposure. Early warning signs of cataracts. Many people think cataracts only mean severe vision loss. But in fact, the early signs are quite noticeable. Blurred vision, like looking through a fog, at first mild, then worsening over time. Glare or halos around lights, especially at night. Double vision, one object appearing as two. Colors fading, a rose is no longer bright red, the sky no longer a deep blue. Frequently changing eyeglasses, yet still not seeing clearly. I once met a retired driver who told me, "Doctor, I can't tell if the oncoming lights are from one car or two." That's why I went for an eye exam, and it turned out to be cataracts. When should you see an eye doctor? Immediately. There are 5 situations where you should not delay: sudden blurry vision, unable to see faces clearly, light scattering or uncomfortable glare, difficulty reading, watching TV, or cooking, inability to recognize family members' faces, frequent glasses changes without improvement. After age 50, eye exams every 6 to 12 months are as important as checking blood pressure or diabetes. Are cataracts dangerous? Many ask me, "Doctor, can this disease cause blindness?" The answer is yes, if left untreated. When the lens is completely cloudy, no light enters the retina, and vision is nearly lost. Cataracts can also increase the risk of falling, due to poor depth perception. Depression, from losing independence and joy in life. Glaucoma, if the lens swells and raises eye pressure. Can cataracts be prevented or slowed? Cataracts are part of natural aging, but we can slow progression by eating plenty of vegetables, omega-3 rich fish, and foods with vitamins A, C, and E. Avoiding smoking and alcohol, wearing sunglasses in the sun, controlling diabetes and blood pressure, having regular eye exams. One elder in my hometown drank green tea daily, ate lots of vegetables, and maintained good health. At 70, he only had mild cataracts and didn't need surgery yet. Treatment: are there medicines for cataracts? This is the question I hear most often. The truth is, there are no eye drops or pills that can cure cataracts. Some may slow them down, but they cannot reverse clouding. The only effective treatment today is surgery to replace the cloudy lens with an artificial one. When is surgery needed? Not everyone with cataracts needs immediate surgery. The rule is, if daily life is not affected much, you may just monitor. If blurry vision interferes with reading, cooking, walking, or recognizing faces, then surgery is recommended. For example, a 62-year-old farmer I treated could still farm at first, though vision was a little blurred. But years later, he could no longer distinguish seedlings from weeds. That's when surgery became necessary. Is cataract surgery dangerous? Nowadays, cataract surgery is very safe. It usually takes only 15 to 20 minutes, and most patients don't need long hospital stays. The doctor removes the cloudy lens and inserts a clear artificial one. Success rate: over 95%. Most patients can read and watch TV clearly within days. Possible complications, though rare and treatable: infection, bleeding, or posterior capsule clouding. After surgery, what to watch out for. Use prescribed eye drops properly. Avoid rubbing the eyes or heavy lifting in the first weeks. Wear protective glasses outdoors. Attend follow-up visits on time. I once operated on a 70-year-old man. After surgery, he emotionally told me, "Doctor, I can finally see every wrinkle on my wife's face again." Moments like these make our work profoundly meaningful. Costs and health insurance. Many elders worry about cost. The good news is, cataract surgery is now well covered by health insurance, especially in public hospitals. The cost depends on the type of intraocular lens, single focus or multifocus, but overall, it's a worthwhile investment to restore sight and joy in life. Closing message on cataracts. Dear friends, our eyes are truly the windows of the soul, the way we connect with life and loved ones. Don't let cataracts steal that joy. If you or a loved one notice blurred vision, glare, or faded colors, please see an eye doctor. Today's surgery is simple, safe, and can restore vision almost like before. Remember, early detection, timely treatment. Don't fear surgery, it is the path to regaining light. The silent thief of vision, age-related macular degeneration, AMD. There is another eye disease I call the silent thief of vision. It causes no pain, no redness, but one day you realize you can no longer see your grandchildren's faces clearly, or read the words in your favorite book. That disease is macular degeneration. The macula, the eye's center. At the back of the eye is the retina, a thin film lining the eyeball. In the center lies a tiny golden spot, the macula. This area has the highest concentration of light-sensing cells, helping us see details, colors, and faces. If the eye is a camera, the macula is the most sensitive part of the film. When it's damaged, the center of the picture blurs. What is macular degeneration? Age-related macular degeneration (AMD) is when macular cells are gradually damaged by aging. Patients still keep peripheral vision seeing surroundings, but the central vision becomes blurred or distorted. AMD is the leading cause of irreversible vision loss in people over 50. Why call it a silent thief? Unlike cataracts that can be surgically corrected, macular degeneration has no complete cure. It progresses slowly, without pain, without redness, only gradual blurring. Many think it's just normal aging and don't seek care. By the time they notice, the central vision is permanently lost. One patient once told me, "Doctor, I still see my grandchildren walking around, but I can't see their faces anymore. Sometimes I even mistake my son for my grandson." Causes and risk factors. You're more likely to develop AMD if you have age over 50, especially over 65. Family history. Smoking doubles the risk. Diabetes, hypertension, high cholesterol. Sun exposure and UV rays. Poor diet, lacking leafy greens and rich in saturated fats. Two types of AMD, dry and wet. Dry AMD, 80 to 90%, macular cells gradually degenerate. Yellow deposits drusen and appear. Slow progression over years. Wet AMD more dangerous, abnormal blood vessels grow under the retina. They may leak fluid and blood. Vision can deteriorate within months. Early warning signs of AMD. Watch for blurry central vision while side vision remains. Straight lines appearing wavy or letters distorted. Colors fading. Difficulty recognizing faces up close. Needing brighter light for reading. One retired teacher patient told me, "Doctor, when I read the newspaper, the lines look wavy, the letters don't sit straight." This is a classic early sign. When to see a doctor immediately. Sudden central vision loss or distortion. Dark spots or empty areas in your central vision. Abnormal fading of colors. Rapid vision decline within weeks. Regular yearly eye exams after age 50 are crucial. Can AMD be cured? Currently, no complete cure. But medicine can slow the disease and preserve remaining vision. Dry AMD. Supplements, vitamins, lutein, zeaxanthin, zinc, omega-3. Wet AMD. Anti-VEGF injections into the eye, or laser therapy. The key, early detection. Once vision is lost, it cannot be restored. Role of nutrition and lifestyle. Studies show diet can reduce progression risk. Dark leafy greens, spinach, kale, lutein, zeaxanthin. Fatty fish, salmon, mackerel, sardines, omega-3. Brightly colored fruits and vegetables, carrots, oranges, pumpkin, papaya. Avoid animal fats and fried foods. Quit smoking, limit alcohol. One of my patients, after early diagnosis, changed her diet, exercised, and managed blood pressure well. 5 years later, her disease remained mild and stable. Living with AMD, how to adapt. Though incurable, patients can still live well by adapting. Use magnifying glasses for reading. Use large, clear fonts. Improve home lighting. Train to use peripheral vision. Use assistive devices or audiobooks. Most importantly, maintain optimism. Many patients suffer depression when central vision declines. A message for families. If you have parents or grandparents over 60, watch if they squint or lean close when reading. Ask if words appear distorted. Take them for regular eye exams, even if vision seems fine. One young man once brought his mother to me. Because she was diagnosed early with wet AMD, we could treat her with injections and preserve most of her vision. A few months later, it might have been too late. Closing message on AMD. Dear friends, our eyes are the light of the soul. Macular degeneration is frightening, but with prevention and early detection, we can protect vision longer. Remember, after 50, don't dismiss blurry vision as just aging. Regular eye exams, especially if letters look distorted. Healthy diet, quit smoking, manage chronic diseases. Don't let the silent thief steal away the joy of seeing your grandchildren's faces, your favorite books, or the morning sunlight. Thank you for listening to today's sharing. If you found this video helpful, please share it with friends, so more older adults can learn to recognize and prevent cataracts and macular degeneration. I wish you bright eyes, a bright spirit, and a joyful, fulfilled life.